Hello guys, welcome to SKK Classes NZ again. So now I'm just going to discuss the next part of treatment of diabetes mellitus, that is insulin. So let's discuss that. And the next point is your insulin. I think you people are very much familiar about this word insulin. So insulin is coming in various forms, and especially it is given in the patients with the type 1 diabetes mellitus. So that all of you know that in type 1 diabetes mellitus the body is not producing insulin. Okay, and we have to provide insulin to the patient in the form of in synthetic form from outside, that can be given in the like insulin injectable form. Insulin injections will be there, depends, and its units depends upon the blood sugar level of the patient. Then insulin pens, they're also known as Lantus, is there. Then insulin pumps, okay, insulin infusion pumps that always started in those patients who are hospitalized or in the intensive care units, just to monitoring the blood glucose level, and if the patient is having a more than 600, 500, so in that situation we can start the insulin infusion pumps. But those patients who are in the hospital or in the intensive care units, and uh, whose body needs continuous monitoring. Okay, next is your rapid acting inhaled insulin. That some insulin is also coming in the form of inhalation, means through inhalation your blood glucose level get down. So this is the third treatment line. Next one is the your diet, okay, which is the most important part, that is your diet, from where, and this is a type of treatment, you can say, you can manage by your own. Okay, there is a no need to go to hospital. But with if you are not if your glucose level sometimes get high or sometimes get low, so our patient know everything about diabetes, so they those persons can you can say manage their own health with the diet. So, if I'm talking about a diet, so you can say that diet planning, or you can say the meal planning, or choosing a healthy diet, that is also the main key point to control the diabetes. Okay, or diabetes, to control the, or you could to manage the diabetes, because food greatly impacts your blood sugar level. Okay, impact means the whole blood glucose level, that depends upon your diet, that what you are eating and what you are not eating. Okay, so for example, if you take insulin, so counting the carbohydrates in your food as well as in your drinks, that how much you have consumed, that is a large part or the main part of your diet management. Okay, suppose if you're taking the diet by having a lot of carbohydrates and a lot of calories, and you're also taking the insulin, so what will happen? Nothing, your glucose level will not be lowered. Okay, so amount of carbohydrates or whatever you are eating, okay, so they just determine that how much insulin you need at meals. Okay, so for that you have to acquire the healthy eating habits, so that you can help yourself to manage your weight, as well as diet management can also helps you to decrease the like heart diseases. Because if you're diabetic, you are suffering from diabetes, so a lot of chances are that you can acquire some heart diseases, you can acquire some kidney diseases, because there are various complications of diabetes mellitus are there, that we will discuss later. But now we have to focus on the diet management of the diabetes. So you have to control your carbs. Okay, whatever you are eating, you should know that which food is having a high carbohydrates, and which food is having a high carbohydrates, and which food is having low carbohydrates. So I'm just going here to display one picture. This is a like a food which helps to lower blood glucose level for the diabetes. Like dark leafy green vegetables are there, non-starchy vegetables, and beans, peas, lentils, whole grains. And these are the types of fruits which are having a low glycemic index, like a low glucose is there. So you can eat these foods so that you can manage your diabetes mellitus at your home if you are not you are having a chronic diabetes. So this is all about the diet management for the patients. So this is all about the insulin treatment and the diet which must be followed by the patients who are suffering from diabetes mellitus. So thank you for watching SKK Classes NZ, and don't forget to subscribe my channel on YouTube.